Hello everyone, I'm Dr. Eric Ruhland from the St. Paul Pet Hospital. Today I'm going to be talking to you about oral hygiene and care in our small animal patients, in our cats and dogs. Maverick, my lab, has asked to volunteer, so he's going to be our model for the day, like most days. You know, a lot of our pets and our cats and dogs, they can't take care of their own oral hygiene, and unlike us, we brush our teeth twice a day. These guys require us to do a lot of our hygiene for them. And the reason that oral hygiene and care is so vitally important is that their mouth of a dog and a cat really is a window to the rest of their body. And when we start looking at how much plaque and tartar their teeth are putting on, it's really eye-opening to have the effects the rest of the body can endure from just the teeth and oral hygiene. It's why it's so vitally important for people to get regular checkups with your dentist to make sure that we're not forming a lot of plaque and tartar. Plaque and tartar on teeth is actually a biofilm of living and dead bacteria. Specifically, the bacteria is Porphyromonas bacteria. And when that biofilm starts to grow, we actually start to see that slimy plaque start to form, and eventually it starts to form the hardened plaque. And that plaque, as it starts to gain access to the gum tissue, is where we start to see issues. Now, Maverick just had a dental done not too long ago, so his teeth are quite clean. You'll see they're quite white. And a lot of times when you look at a dog's mouth, a lot of the plaque and tartar does not really form on the front incisor teeth. But as you start to move back along the back teeth, and it's why your veterinarian will usually lift up that lip and look at the gum tissue far back, specifically this tooth called the carnasal tooth, and our back molars is where a lot of that plaque tends to form. And that's where you really want to look and pay close attention to those back teeth, and you really want to open those lips up and look at the back part of the teeth. Thanks, Maverick. To look and see where that plaque and tartar is forming. Now, that plaque and tartar, as it starts to get into the gum tissue, will actually gain access to the blood supply and will start to shower the rest of the body with bacteria. Because the Porphyromonas bacteria doesn't just like to stay there, it wants to go through the rest of the system and cause abscesses and plaque. It'll actually form plaque on the valves of the heart. It can cause abscesses in the liver and the lungs. So keeping our dog's teeth and our cat's teeth really clean is vitally important. To do that, I like to recommend to a lot of our dog and cat owners, if they can, and I know that's not easy, to brush their teeth of their dogs and cats at least once a day. If you can't brush the teeth, sometimes using a little bit of gauze wrapped around your finger to get in and mechanically kind of scrape and brush that off. Now, Maverick, he's pretty amicable. He usually lets me do this, and I actually will brush his teeth usually once a day if I can. And we just like to use just a plain toothbrush, no toothpaste on it. There are toothpastes on the market that are flavored with turkey and a couple other things just to let dogs do it. But Maverick usually lets me do it pretty good. I like to kind of hold my toothbrush like this, lift his lips open, and really brush along the insides of the teeth, and then get along just a couple seconds on each side, and then switch down to the bottom. And just a couple seconds, just like us. You want to really angle that toothbrush in there and get along those teeth. Now, a lot of people would say, you know, Dr. Eric, you're kind of asking a lot for me to brush my dog's teeth once a day. But I will tell you what, I can almost guarantee you when I look at a dog's mouth, I can almost guarantee you when I listen to a dog's heart, that their heart and their teeth are very closely correlated. A lot of dogs and a lot of people that develop heart murmurs and develop cardiac problems they're forming those issues because they've had such bad oral hygiene. Now, if you can't brush your dog's teeth every day, that's understandable, but we still need to you still need to have your veterinarian take a look at those teeth probably every 6 months to every year to get a good assessment of when they're going to need an actual prophylactic cleaning. Now, in our cats and dogs, we can't just ask them to hold their mouths open while we scrape the plaque off and we ultrasonically scale them. A lot of times, 99% of the time, our pets need to be put under general anesthesia, and we have to go in and do a full dental. So it really gives us another chance to really look at those teeth closely and see if we have to make extractions. So I guess just to reiterate with everyone, trying to keep those teeth clean, brushing once a day, just like people. Unless you can brush once a day, every other day is okay. But to stay ahead of it, we need to be brushing once a day, or using some gauze wrapped around the finger and scrape those teeth down. That's going to be the best thing for them long term. And if not, make sure your veterinarian's taking a good look at those teeth every 6 months at least, at a bare minimum every year. And your veterinarian will be able to give you a little bit more insight as to where your pet's oral hygiene is at and how much plaque and tartar is on those teeth. And they'll give you a little bit better assessment as to when they might need a prophylactic cleaning. That's it from the St. Paul Pet Hospital and Dr. Eric Ruhland. Maverick's just signing off here, and hopefully I'll see you around the great city of St. Paul.